Welcome back, everyone, to another deep dive. Today, we are going to be looking at nursing assessments.
Ooh, assessments.
Yeah,
Very important.
so important. And this deep dive is really going to be targeted for all of you nursing students out there who are taking your fundamentals course and just starting to learn about assessments because it's a lot.
It is a lot. It's a lot to learn, and it's so important to get it right.
So important. So we're going to dive in. We're going to use some excerpts from your fundamentals textbook. You know the one?
Yes.
You got it right there with you?
The big one.
Yeah. And it's full of all these really interesting scenarios that really bring the concepts to life. So we're going to be using those a lot in this deep dive. We're going to be talking about a 17-year-old named Sylvia who just got back from China, and she's worried about a new virus going around.
Oh.
We're going to be talking about the difference between what nurses assess versus what doctors assess, and how it's really about the patient's response and not just about the medical condition itself.
Yeah.
And then we've got a really cool mnemonic to help you remember key areas for patient observation.
Awesome. Love a mnemonic.
I know, me too. It's called HELP, and we will get into that a little bit later.
All right. I'm excited.
Okay, so let's just jump right in. I know all of you nursing students are super busy, and you just want the good stuff.
Yes. Get to the point.
So let's talk about what assessing actually is.
Okay. So it's a very systematic process, and it's continuous, and it's the collection, analysis, validation, and communication of patient data. So there are a lot of pieces to that.
There are a lot of pieces.
Yeah.
And I think it's so interesting that you pointed out that it's continuous, because that means it's not just a one and done type of thing.
No, it's ongoing. You're always assessing your patient.
Always assessing.
Yeah.
Because things change,
Yeah.
and they change quickly.
Absolutely.
And so you as the nurse need to always be aware of what's happening with your patient.
You got it.
So a good assessment allows the nurse to make judgments about the patient's health status,
Yeah.
their ability to manage their own care, and the need for nursing intervention.
Absolutely. And you can see that in all of the examples that you gave from the book, like Susan, who has multiple sclerosis, Sylvia with a potential virus, and James, who is grieving.
Right. So all of these patients have different needs. And it's through the assessment that we're able to figure out what those needs are.
Exactly.
And the textbook goes on to identify 6 different types of nursing assessments.
Okay, I'm ready.
Let's run through those.
Okay.
So we've got the initial assessment.
Yes, so that's the one you do when the patient is first admitted. It's all about getting that big picture of what's going on with them.
Like a full head-to-toe assessment.
That's exactly.
Then we've got a focused assessment.
Right, so that's when you're zeroing in on a specific problem the patient has. Like if they're complaining of abdominal pain, you're going to focus on that.
Okay. Then we have quick priority assessments.
Yes. So those are important when a patient's condition is changing rapidly. You need to get the most important information quickly to see if there are any problems.
Like if they're having trouble breathing.
Exactly.
Okay. Now emergency assessments.
Those are even more intense. You're looking for life-threatening problems, things like a blocked airway or uncontrolled bleeding.
So those are usually done in emergency situations.
Right, when you need to act fast.
Okay. We've also got time-lapsed assessments.
Yes, so those are really important in long-term care settings. You're comparing the patient's current status to their baseline to see if there have been any changes over time.
Like if their mobility has declined or their mental status has changed.
Right, you're looking for trends and patterns.
And lastly, we have triage assessments.
Triage is all about prioritizing patients based on the severity of their condition. You see this a lot in emergency departments and urgent care centers.
So it's about making sure the sickest patients are seen first.
Exactly.
So that's a lot of assessments.
It is, but each one serves a different purpose.
Right. And it's about choosing the right assessment for the right situation.
Exactly.
Now let's get back to Sylvia, our 17-year-old who just returned from China. She's worried about this new virus. And, this is something that could potentially be really scary for both the patient and the nurse.
Absolutely.
Right? Because there's the fear of the unknown. There's the potential for the virus to spread. So how does the nurse even begin to approach a situation like this?
Well, the first thing is to stay calm and not let fear take over, because that can really impact how you care for Sylvia.
Right. It's about remembering your QSEN competencies, right?
Exactly. Quality and safety education for nurses. One of the key competencies is patient-centered care.
which means...
treating each patient as an individual with their own unique needs and preferences.
So in Sylvia's case, how would you balance providing patient-centered care while also addressing those potential public health concerns?
It's a delicate balance.
Wow.
You want to reassure Sylvia, address her fears, but you also need to protect yourself and others.
And this is where those ethical considerations come in.
Absolutely. Nurses have a responsibility to advocate for their patients, but they also have a responsibility to protect the public health. It's a tough situation.
And the textbook actually has a little legal alert about this.
Oh, really?
Yeah. It says that nurses are responsible for alerting other healthcare professionals when they suspect a communicable disease.
That makes sense. You don't want to put anyone at risk.
Exactly. So it's all about finding that balance between providing compassionate care and protecting everyone's safety.
Right. And clear communication is key. You need to explain the situation to Sylvia in a way that she understands, and you need to make sure everyone on the healthcare team is on the same page.
Now let's talk about how we actually gather data during an assessment.
Okay, let's do it.
Our textbook mentions something called the minimum data set.
Yes, so that's basically a list of essential information that hospitals collect on every patient.
So things like vital signs, allergies, current medication.
Exactly. It's the bare minimum they need to know.
Right. And then we've got these different models of assessment.
Yes.
Like the holistic model and the body systems model.
Right. So the holistic model is all about looking at the whole person.
Not just their physical symptoms.
Exactly. You're considering their emotional, spiritual, social, and cultural needs as well.
And how all of those things interact to influence their health.
You got it.
And then the body systems model is more about assessing each body system individually.
Right. It's a more structured approach. And it can be really helpful for new nurses who are still learning all the different parts of the body.
So it's like a checklist.
Kind of. You're making sure you're assessing each system thoroughly.
Now, earlier we mentioned a mnemonic called HELP.
Yes, I love that one.
Me too. It's so helpful for remembering key areas for patient observation.
So can you break it down for us?
Absolutely. So H stands for help.
Okay.
You're looking for signs of distress. Is the patient struggling to breathe? Are they in pain? Do they seem confused?
Got it.
E stands for environment.
Okay.
You're assessing the patient's surroundings.
Okay.
Is it safe? Is there any clutter? Are all the equipment and supplies working properly?
That makes sense.
L stands for look.
Okay.
You're observing the patient's physical appearance, their skin color, their posture, their facial expressions.
Got it.
And finally, P stands for people.
Oh.
Who's in the room with the patient? Are they family members, friends, healthcare providers? How are they interacting with the patient?
That's such a helpful tool. I can see why you love it.
Me too. It's simple, but it covers a lot of ground.
Absolutely.
Now let's talk about another key concept, subjective and objective data.
All right.
So subjective data is what the patient tells you. It's their perception of their experience.
Like their pain level or their symptoms.
Exactly. And objective data is what you can observe and measure.
Like their temperature or their blood pressure.
Right. So you need both types of data to get the full picture.
Absolutely. You can't rely on one or the other.
Now, our textbook also mentions some challenges that nurses might face when collecting data.
Oh, yeah. There are definitely some tricky situations.
Like what?
Well, what if your patient doesn't speak English?
That's a tough one.
Or what if they've had a bad experience with healthcare in the past and they're distrustful of nurses?
Or what if they have unrealistic expectations about what nurses can do?
All of these things can make it difficult to gather accurate data.
So how can a new nurse navigate these challenges?
Communication is key. You need to be patient, empathetic, and a good listener.
And sometimes you need to get creative.
Absolutely. Like using visual aids or finding a translator.
The goal is to build trust with the patient so they feel comfortable sharing information with you.
Exactly.
Now let's talk about some key qualities of a good nursing assessment.
Okay.
Our textbook says that assessments should be purposeful, prioritized, complete systematic, factual, accurate, and relevant.
Wow, that's a lot.
It is, but it's important to break it down and understand what each of those terms means.
Okay, so let's start with purposeful.
Yeah.
Why are we doing this assessment? What are we trying to find out?
Right. Then prioritized. What's the most important information we need to gather first?
Makes sense.
Complete means getting enough information to understand the patient's needs.
But not necessarily every single detail about their life.
Exactly. Systematic means having a structured approach. So whether you're using a head-to-toe assessment or a body systems approach, you're following a specific order.
That helps ensure you don't miss anything.
Right. Factual and accurate means sticking to the facts and double-checking your information.
Don't just rely on what the patient tells you. Validate your findings with objective data.
And finally, relevant means making sure the information you're gathering is actually important for the patient's care.
So no extraneous details?
Exactly.
That makes a lot of sense.
So it's a lot to keep in mind.
It is. But with practice, it becomes second nature.
And the more you do it, the better you'll get at it.
Absolutely. And your patients will benefit from your thorough and accurate assessments.
So that's a wrap for part 1 of our deep dive into nursing assessments.
Wow, we covered a lot of ground.
We did, but we're not done yet.
Oh, good. I was hoping you'd say that.
In part 2, we're going to dive even deeper into the world of assessment.
Can't wait.
We'll talk more about subjective and objective data. We'll explore different types of interview questions.
Awesome.
And we'll even get into some physical assessment techniques.
I'm ready.
So make sure you join us for part 2.
I wouldn't miss it. It's really about putting all the pieces together to get that complete picture of our patient.
I like that. And it's not just about like the physical assessment either.
Right, exactly.
Yeah.
We have to think about their emotional state, their support system, any cultural considerations, all those things that make them unique.
Yeah. Because all of those things can affect, their physical health.
Absolutely.
So, thinking about that, I'm remembering that the text talked about those different assessment models, like the holistic one versus the body systems approach.
Yeah. So with that holistic model, you're really focusing on how everything's connected.
Right.
Like how are their physical symptoms, related to their emotional well-being and their social life and all of that.
Yeah. It's like a web.
Exactly.
That must be pretty challenging, though, for like a brand new nursing student to try to wrap their heads around all of that.
They can be, yeah. But it's something to kind of work towards.
Right.
Because, you want to be thinking about the patient as a whole person instead of just, a bunch of different symptoms or body systems.
Okay. So then how is the body systems model different?
Well, with that one, you're really just looking at each body system separately.
Okay.
It's a little more structured.
Right.
It's like one at a time.
Mm-hmm.
And I think it can be easier for new nurses to use.
Yeah. Just to kind of make sure that they're covering everything.
Exactly. You don't want to miss anything.
Right. And the text also mentions, this thing called the minimum data set.
Yes.
Which I guess is basically like, every hospital has certain information that they need on every patient.
Yeah. They need to have that, for all sorts of reasons, like billing and stuff like that.
Right. Regulatory stuff.
Exactly. And a lot of times that minimum data set kind of lines up with that body systems model.
Okay.
Because it's asking you to look at specific things within each system.
So it's kind of like a standardized way to make sure that you're collecting the right information.
Exactly.
All right. Now we have to talk about HELP.
Yes.
I'm so excited.
Me too. Such a good one.
It's so good.
Yeah.
So for all of you nursing students out there listening, this is a mnemonic
Yes.
that will help you remember like the key areas that you need to observe when you're with a patient.
It's a lifesaver, I'm telling you.
So what does it stand for?
Okay. So HELP, help environment, look, and people.
Okay, awesome. So break that down for us. Like, how would you actually use this?
Okay, so first, we're looking for signs of distress, right? So is your patient struggling to breathe? Are they showing signs of pain? Maybe they're grimacing or, guarding part of their body. Or are they confused? That's the help part.
Okay, so you're really just looking to see, is this patient in distress right now?
Exactly.
And then environment.
Right. So think about the patient's immediate surroundings. Is it safe? Are there any spills or, equipment that's not working properly? Things like that.
Okay. So, just making sure that the environment is conducive to healing.
Exactly.
And safe.
For you and for the patient.
Yes.
And then look.
Okay. So with look, you're really observing your patient's appearance. So, how's their skin color? Do they have any obvious injuries or abnormalities? How are they holding their body? Are they making eye contact?
So it's really about those visual cues.
Yeah, exactly.
Mhm.
Sometimes they can tell you more than the patient can.
Yeah, sometimes people don't even realize that they're doing certain things with
Right.
their body language that can be indicative of something.
Exactly.
Okay. And then last, we have people.
Right. So who else is in the room? Are they family members? Are they friends? Is there a chaplain there? Are there other healthcare providers?
Yeah.
And, how are they interacting with your patient?
Yeah. Are they being supportive or
Right. Exactly.
are they stressing the patient out?
Exactly. You want to kind of notice all of that.
That's so smart. I love HELP.
It's so good. I tell all my students about it.
So helpful. Okay. So now we need to talk about subjective and objective data.
Okay.
Two very important concepts.
Very important. So let's start with subjective. What is that?
So subjective data is anything that the patient tells you. It's their feelings, their perceptions. It can't be measured.
So that's like their story.
Exactly. It's how they're feeling.
Right. And objective data is...
It's what you can observe and measure.
Okay.
So things like vital signs, lab results, anything that you can see, hear, touch, or smell.
Okay, so thinking back to Sylvia,
Yes.
her saying, oh, I have a sore throat,
Hmm.
would be subjective data.
Right, because that's how her throat feels to her. We can't measure that.
Right. But if you look at her throat and you see that it's red and inflamed...
Then that's objective.
That's objective.
Because you can see that.
Exactly.
You can measure that.
And, you need both of those pieces.
Yes, you need the whole picture.
To really figure out what's going on with the patient.
Absolutely.
Now, the text mentions that, sometimes collecting data can be kind of challenging.
Oh, yeah, for sure.
Like, what are some examples?
Well, what if you have a patient who, doesn't speak the same language as you?
Right. That's a big one.
That can be really tough.
Right.
Or maybe they've had a bad experience with healthcare providers in the past, so they're not very trusting.
Right. Or maybe they have unrealistic expectations of what you as a nurse can do for them.
Exactly.
Yeah.
All of those things can make it really hard to get that good, accurate data.
So how can a new nurse, handle those tricky situations?
Well, I think communication is so important in those moments.
Okay.
Really taking the time to listen to your patient, showing empathy, being patient yourself. Sometimes it takes a little bit of time to build that rapport.
Yeah. It's about building trust.
Exactly.
It's that the patient feels comfortable opening up to you.
Exactly.
And sharing what's going on.
You got it.
Now, the book talks about all these different qualities of a good assessment.
Yes. It's a long list.
It's a lot. So
Yeah.
they should be purposeful, prioritized, complete, systematic, factual, accurate, and relevant.
Okay. Let's unpack all that.
Yeah. So what does it mean to have a purposeful assessment?
Well, you have to know why you're doing it, right? What are you hoping to learn about your patient?
Okay. So you have a goal in mind before you even start.
Exactly.
And then prioritized.
Well, we have to think about, what's the most important information to gather right now?
Right. Like if somebody is having trouble breathing.
Exactly. That takes priority over, asking about their bowel habits or something like that.
Right. Okay. Complete.
So with complete, you want to make sure you're gathering enough information to really understand what's going on with your patient.
Right. So you're getting the full picture.
Exactly.
But it doesn't mean, asking them every single question under the sun.
Right. You have to use your judgment and your clinical reasoning skills to decide, what information is important.
And then systematic.
So systematic means having a system.
Okay.
Whether you're using a head-to-toe assessment or focusing on body systems, you're following a specific order.
Okay.
And that just helps to make sure that you're not missing anything.
So you're not just jumping all over the place.
Exactly.
You're being very deliberate.
You got it.
Okay. And then factual and accurate. Those seem pretty self-explanatory.
Well, yeah, but, it's easy to make mistakes.
Yeah.
Especially when you're new.
Right. Or you're stressed or tired.
Exactly. So always double-check your information. Make sure you're documenting everything correctly.
Right. And if something doesn't seem quite right,
don't be afraid to ask.
Ask for help.
Yes. Get a second opinion.
And then relevant.
So relevant means making sure that all the information you're gathering is actually pertinent to your patient's care.
So no unnecessary questions or exams.
Exactly. You don't want to waste time or make the patient uncomfortable.
Okay. So it sounds like there's a lot to keep in mind when you're doing a nursing assessment.
There is. It's a lot to juggle, but the more you do it, the easier it becomes.
Yeah. It's like anything else. Practice makes perfect.
Exactly. And your patients will thank you for it.
Okay. So now we need to talk about something that I think trips a lot of new nurses up.
Okay. What's?
It's documentation. Like the textbook emphasizes, not using vague terms when you're charting.
Oh, yeah. Words like adequate or good or normal.
Yeah, what does that even mean?
Exactly. One nurse's normal might be another nurse's, abnormal. So be specific.
Give concrete details.
Exactly. Say, the patient's respirations are 16 breaths per minute and unlabored, instead of just saying respirations are normal.
Okay. So paint a picture with your words.
Exactly.
And then the text also talks about cues and inferences.
Right. So a cue is basically a piece of data that you gather.
Either subjective or objective.
Exactly.
And then an inference is?
It's the judgment that you make about that cue.
So it's like you're putting the pieces together.
Exactly.
Like a puzzle.
Okay. So if a patient says, I'm feeling dizzy, that's a cue.
Right. And then you might infer that they're dehydrated.
Or their blood pressure is low.
Exactly.
Yep.
But the key is to validate those inferences.
Right. So you're not just jumping to conclusions. Exactly. You might check their blood pressure, ask them about their fluid intake, maybe get a second opinion from another nurse.
Okay? So it's all about critical thinking
Exactly.
and not just taking things at face value.
You got it.
Now let's talk about reporting and recording.
Two very important aspects of the assessment process.
So if you notice a significant change in your patient's condition,
You need to report it right away.
right, don't wait until the end of your shift or, till the doctor happens to come by.
Exactly. If it's important, it needs to be communicated immediately.
And then, of course, all of your assessment findings need to be documented.
Purely and accurately.
Right, because the patient's chart is a legal document.
Exactly. And it's also how we communicate with other members of the healthcare team.
So everybody's on the same page.
Right.
Now, the textbook also mentions privacy and confidentiality.
Very important, especially in this day and age of social media.
Right.
You have to be so careful about what you say and where you say it.
Yeah. Because, as nurses, we have access to a lot of sensitive information.
Exactly. And it's our responsibility to protect that information.
Okay. So just a little reminder to all of you out there to be mindful of patient privacy.
Absolutely.
And then finally, the text encourages us to reflect on our experiences.
Self-reflection is so important for growth.
So, taking some time to think about what went well, what could have gone better,
Exactly. What did you learn?
and how can you improve your assessment skills next time.
You got it.
Awesome.
Yeah.
Okay. So that's a lot of information about nursing assessments.
It is. But hopefully it's helpful for all of you nursing students out there.
Yeah. And we're not done yet.
We're not.
We still have part 3 to go.
I'm excited.
Me too.
See?
In part 3, we're going to talk about, some specific techniques for conducting patient interviews and physical assessments.
Ooh, the hands-on stuff.
Yes. So make sure you join us for that.
I wouldn't miss it.
Okay. So we're back and we're ready to get hands-on.
Let's do it.
Yeah. Let's talk about patient interviews and physical assessments.
All right. Two of my favorite things.
Mine too. So, we got to start with that patient interview because that's really the first step in getting to know our patient.
Right. It's that time where you can, build that connection with them, make them feel comfortable and safe.
Yeah. Because the book really stresses,
Yeah.
It's not just about asking questions.
No, it's so much more than that.
It's about creating that space for them to share their story.
Exactly. And, sometimes they'll tell you things that you never would have thought to ask about.
Right.
Yeah.
Exactly. So how do we actually go about setting the stage for a good patient interview?
Well, I think the first thing is to be prepared.
Okay.
Take a few minutes before you go in the room to, look over the patient's chart, familiarize yourself with their history, any previous assessments, any, current concerns they might have.
Okay, so you kind of have a little bit of background information
Exactly.
before you even walk in.
You don't want to go in there blind.
Right. And then?
And then when you do go in, make sure you introduce yourself. Explain, what your role is. Verify the patient's name and their pronouns.
Okay, so it's all about respect.
Exactly. You want to start off on the right foot.
And then the listening begins.
Yes, active listening is so important.
So important. Yeah. And the book, really hammers this point home.
It does. It's not just about hearing the words that your patient is saying. It's about really tuning in.
Right, like to their tone of voice.
Yeah, their body language. Are they making eye contact? Are they fidgeting? All those little things.
Yeah, those nonverbal cues can tell you so much.
They can. Sometimes a patient might say that they're fine, but their body language is telling you a completely different story.
Right, exactly. And sometimes, just being quiet and giving the patient that space to talk.
That can be so powerful.
It can be.
Just let them share what they need to share.
And now when we're asking questions.
Yes.
The book says, try to avoid leading questions.
Right, because you don't want to put words in your patient's mouth.
Right. So instead of saying, you don't smoke, do you?
Exactly.
You would say something like,
tell me about your lifestyle habits. Let them tell you about whether they smoke or not.
Right. And, I think it's important to mention, too, that, cultural considerations can really play a role in how you approach the patient interview.
Absolutely. Some cultures are more reserved than others.
Right.
And, direct eye contact might be considered disrespectful in some cultures.
Yeah. So you have to be aware of those things.
You do. And it's okay to ask the patient, what are your preferences? Is there anything I can do to make you feel more comfortable?
Right. Just being open and respectful.
Exactly.
Okay. So the patient interview is just the first step.
Yes. Then we move on to the physical assessment.
Dun, 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 dun.
The hands-on part.
This is where we get to use all of our senses.
Right. Like touch, hearing, even smell sometimes.
Oh, yeah.
You can learn a lot about a patient just by observing them.
So we're inspecting their skin?
Yes.
Palpating their abdomen?
Right.
Auscultating their lungs?
Exactly.
Looking in their ears and their nose?
All the things.
And I think, something that's really important to remember is to pay attention to the patient's overall appearance.
Yeah, like how are they groomed?
Right. Are they diaphoretic?
Are they holding their body in a certain way that suggests pain?
Right.
All of those things can give you clues about what's going on.
Yeah. Okay. So what are some tips for conducting, a really good physical assessment?
Well, first of all, make sure your patient understands what you're going to be doing.
Okay.
Explain each step clearly. Answer any questions they might have.
Right. Because it can be kind of scary.
It can be.
Yeah.
Especially if they're not feeling well or if they've never had a physical assessment before.
Right. So you got to put them at ease.
Exactly. And then remember those key principles of assessment.
Okay.
Purposeful, prioritized, systematic, factual, accurate, and relevant.
So we're not just doing things for no reason.
No. Everything we do has a purpose.
And we're focusing on the most important things first.
Right. And we're using a systematic approach so we don't miss anything.
And we're documenting everything accurately and concisely.
Exactly.
And, this might seem obvious, but you have to wash your hands.
Oh, yes. Hand hygiene is so important.
It's important.
Before and after every patient contact. Every time. No exceptions.
Okay. So we've talked about patient interviews. We've talked about physical assessments.
We've covered a lot of ground.
We have.
Yeah.
And I think, the big takeaway here is that assessments are the foundation of nursing practice.
They are. It's how we gather the information we need to provide safe, effective, and compassionate care.
So to all of you nursing students out there listening, don't be afraid to ask questions.
Yes.
Seek out those experienced nurses on your unit and ask for help.
They're a wealth of knowledge.
They are. And don't be afraid to make mistakes.
Everyone makes mistakes. It's how we learn.
Exactly. So just keep practicing, keep learning, and keep striving to be the best nurse you can be.
I love that.
Well, that's it for our deep dive into nursing assessments. We hope you learned a lot, and we'll see you next time for another fascinating exploration of the nursing world.
See you then.